Hi, my name is student Dr. Cassandra. How would you like to be addressed?
Shamabel.
All right, nice to meet you, Shamabel. What brings you into the office today?
I have pain in my right foot.
You have pain in your right foot. Okay, and what happened? When did you start noticing this?
I just noticed that it's just been hurting me very bad.
Okay. And can you point to me where in your foot where the pain is?
Yes. Right here.
Okay. And is the pain something that lasts throughout the day? Is it on and off?
I noticed it mostly when I am on my feet for a long time.
Okay, makes sense. All right, so how would you describe the pain? Is it something that's sharp? Is it stabbing? Is it shooting? Is it achy?
I would say it's more of an ache.
It's an achy pain. Okay, and is there anything that is done that aggravates the pain?
Yes. Usually when I stand up for a long time.
Okay. Is there anything that you do that might alleviate the pain?
I use ice and I get massages.
Good. Does the pain radiate at all? Does it move to another location?
No.
How long have you been feeling this pain?
For about 6 weeks now.
So for 6 weeks. And on a scale of 1 to 10, how would you rate the pain?
An 8.
It's an 8. Okay. So now we're gonna move on to the past medical history. Okay.
Okay.
Are there any recent hospital visits?
No.
Are you up to date on your immunization?
Yes.
All right. And do you have any illnesses right now as an adult?
No.
Do you have any illnesses as a child?
No.
Okay. And are there any illnesses in your immediate family, such as your parents?
Yes.
Okay.
Both of my parents are diabetics.
So if your parents are diabetics, do you have any children?
No.
No children. Are you on any medication?
No.
No medication. Do you have any allergies?
No.
Okay. Have you traveled recently?
No.
And have you had any surgery?
No.
Okay. Now I want to ask you really quickly more about your family history. I know you said that your parents are diabetics, correct?
Yes.
Do you know if your grandparents, if they also had diabetes or if they had any other illnesses?
They were also diabetic.
They were also diabetic.
Mm-hmm.
Okay. And did they die from diabetes?
Yes.
Okay. Now we're going to move on to your social history, okay?
Okay.
So, how was your sleep?
8 hours a night.
8 hours a night, okay? And do you smoke? And if you do smoke, how often?
I do not smoke.
Okay, non-smoker. And do you practice safe and monogamous sex, or do you have multiple partners?
I am married.
You're married, so you practice safe and monogamous sex.
Right.
Okay. Now, what is your line of work?
I am a teacher.
You're a teacher, okay? And how is your exercise? Do you exercise often, moderate, frequently, not at all?
I don't exercise.
Okay. And how is your diet? Would you say that it's balanced? You eat more meats? You eat vegetables?
I would say it's balanced.
Balanced. Okay. All right. So, do you have any pets?
Yes.
Okay. How many pets and what kind of pet is it?
I have one dog.
You have one dog.
Mm-hmm.
Okay. And you said that you're married, correct?
Yes, I am married.
And have you traveled recently?
No.
Okay. So now we're going to move on to the review of systems. It's going to be a series of questions. It's going to be a lot of yes or no's. Okay. All right. So do you have any fever, chills?
No.
Any sweating?
No.
Any dizziness?
No.
Any headaches?
No.
Okay. Any intolerance to heat or cold?
No.
Okay. Do you have any diabetes or hypertension?
No.
Okay. Do you have any heart, chest pain?
No.
Okay. Do you have any shortness of breath?
No.
Any cough with mucus in it?
No.
Okay. Do you have any abdominal cramps?
No.
Okay. Do you have any issues with your bowel movements?
No.
Do you have any pain while urinating?
No.
Do you have any stiffness in your joints?
No.
Do you have any arthritis?
No.
Okay. Do you have any muscle numbness?
No.
Okay. All right. So now I want to move on to your physical exam. Okay. And so we're going to first start off with the dermatological exam. So I'm going to have you sit all the way back. And we're just going to go ahead and check the skin on your legs. Okay. And the skin on your legs look relatively healthy. I do know that there is some hyperpigmentation here. Can you, was this always here?
Yes, I've had eczema since I was a child.
Okay, so you had eczema as a child. Okay, and I also see that there's that also here. But other than that, your legs look relatively healthy. There's no dryness. I'm going to also go ahead and look down at your feet here. There's a little bit of dryness on the dorsal side of your foot. Your nails look relatively healthy, normotrophic, no high, there is no thickness of the nail bed. I'm going to go ahead and check in between the digits. There is some dryness in between the digits, but there's no maceration. I'm gonna go ahead and check in between here. There is no maceration. There is a little bit of dryness bilaterally. I'm gonna go ahead and check the plantar side of your foot. Okay, the plantar side of your foot is, again, relatively healthy. There is a little bit of dryness. There's no scaliness. There is no hyperkeratosis. There is no calluses. All right, so that's the underside of your leg as well. The underside of your leg looks relatively healthy. Okay, on to awesome. Okay, yeah, so the temperature is from warm to cool. There is hair bilaterally from the legs all the way down to the digits. I'm gonna go ahead and check the pulse of your foot. Okay, your pulse on bilaterally is 2 out of 4 palpable. I'm gonna now check your posterior tibial pulse. Okay, this is also palpable, 2 out of 4. I'm now gonna check the capillary refill time. Okay, capillary refill time is less than 3 seconds. Okay, capillary refill time is less than 3 seconds bilateral. Okay. I'm gonna go ahead and check the skin turgor. Skin turgor is normal. There's no pitting edema. There's no edema at all. I don't see any varicose veins at all. Everything looks relatively healthy. Push up, you're gonna push down on my hands. If I push out, you're gonna push in, and if I push in, you'll push out. Okay.
Okay.
All right. All right. Very good. Very good. Okay, very good. 5 out of 5 for the musculoskeletal. Going to go ahead and check your range of motion. Okay, you're gonna just relax your foot here. Okay, very good. Normal range of motion for the subtalar joint. Normal range of motion for your subtalar joint. All right, now I'm gonna try the Liz Franklin here. Normal range of motion. Normal range of motion here as well. Now I'm going to try with your first metatarsal ray. All right, very good. Normal range of motion. All right, normal range of motion as well bilaterally. All right, so now scoid test. I'm going to put your foot in subtalar joint neutral. Dorsiflex the foot. Oh, sorry, relax your foot. Don't help me at all, okay? Okay. Okay. Oh, sorry. Relax your foot. Relax your foot. Okay, there is a little rigidity here. Okay, I think this one might have a little bit of inclinus on the left foot, okay? All right, so now we're gonna move on to the neurological exam, okay? We're gonna first start off with the Sims-1 monofilament test. If you can just have your hand out here. This is what this feels like, okay? You're gonna have your eyes closed as I perform this exam, okay? And you're gonna, anytime you feel it, you're just gonna say yes. Okay, please close your eyes.
Yes. 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 Okay. Yes. 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 Yes.
Okay, 10 out of 10 for the Sims-1 test. All right, so now we're gonna do a proprioception test. You're gonna tell me which toe I'm moving and if it's up or down, okay?
Okay. Big toe up. Toe next to pinky toe up. Pinky toe down.
Very good.
Big toe up. Toe next to big toe down. Pinky toe up.
Okay, 10 out of 10 for the proprioception test. We're now gonna do what's called the sharp and dull test. this is what the dull feels like. And this is what the sharp feels like. Okay?
Okay. Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Uh-huh.
Dull.
Okay. 10 out of 10 for the sharp and dull test. This is what the vibration feels like. Do you feel that?
Mm-hmm.
And this is what it feels like when it stops, okay? Tell me yes when you feel it, it starts. And then when it stops, you just simply say stop, okay?
Okay. Yes. Stop. Yes. Stop. Yes. Stop. Yes. Stop. Yes. Stop. Yes. Stop.
Okay, good. 10 out of 10 for the vibration test. The last thing, we're gonna do 2 more. Just wanna make sure, we're gonna do the Babinski reflex test. Okay. Okay, very good. Normal reflex for the Babinski examination. And then we're going to do a simple reflex test. I'm just going to hit your knee. Okay. Okay, very good. Normal reflex. All right, so I want to quickly recap what we talked about earlier. You said you had pain on your right foot, correct?
Yes.
And you said that it hurts more when you stand for long periods of time.
Yes.
And that it's aggravated when you stand, and then it's alleviated a little bit when you massage it and ice it, which I think is great. First, what kind of shoes do you wear?
I don't wear high heels anymore.
Okay, so one thing I do want to encourage you to do is wear shoes that support your feet. We're gonna also try and give you an orthotic. I'm also leaning towards this might be in a plantar fasciitis because I know that it's pain specifically on your calcaneus bone, your heel. So what I want to do is I want to give you some nasopraxin just to kind of numb the pain a little bit. We'll also do an X-ray just to make sure that it's not anything else. And I want you to come back in 2 weeks so we can see how you progress over time. Okay.
Okay. Thank you.
Thank you.